This is our Forwardontics Up-locker measuring kit. This comes with 2 hoses and 2 saliva traps, one for the Frankel space, one for the Dunder space, and a Up-locker vacuum activator device. This is used to measure the pressure in the mouth and to be able to monitor and learn the correct way to hold our up-lock position in the mouth. We have our manometer here. Our manometer is turned on here, and the first thing we do is we equalize it with the ambient. So you are going to zero it here. You push hold right there, and it's going to zero out your manometer. So we'll be able to measure what's going on in the mouth. We are going to get our Up-locker device that comes in the kit. And we are going to remove the cap. You can remove either the funnel or the cap, but the funnel will give us information too. And I'm going to measure my Dunder space right now. So we are going to put it through that space and make sure it clicks in so there is no losing any air anywhere in the device. The Dunder's tube can be pulled out for bigger mouths or pulled down for smaller mouths. So you want it to reach the middle of the palate where the Dunder space is. So I'm going to put it on, and we are going to put it in our manometer here that's been zeroed, and I'm going to use the right side, which is the negative side. You can do it negative or positive side, it doesn't matter. This will give us the negative. So I'm going to put it in, and you will see me swallow first. When we swallow, we generate 50 or more millibars of negative pressure. We want to swallow a couple times until we're comfortable, and then we want to let go pressure to go to the sweet point, the sweet spot, which is between 10 and 15 millibars of negative pressure. And we want to train 5, 10, 20 minutes holding it in that range. So this is what we do to measure the Dunder space. For the Frankel space, we have a different hose that we can use, and you can use these hoses for multiple patients because they never touch saliva. We can remove the saliva trap and use it for a different patient. Every patient can have their own kit, and we can have our manometer to have the patients, the individuals come in and measure and practice the right pressure in their up-lock position. This is our deglutition or swallowing kit. So let me show you how this works. This can be used with your Up-locker activator, and the way it works is very simple. As we know, when we swallow, the liquid goes in the Dunder space. A lot of people have issues with valve number 3, with the soft palate and the back of the tongue. So if you have somebody that's been on a feeding tube, or somebody that's elderly and they're having problems choking with their own saliva, we can use the deglutition kit to deliver a drop of water or a drop of liquid into the Dunder space and teach them to recognize valve number 3 and train it to hold that suction and that pressure so that the reflex of deglution or swallowing is recovered. And some of the patients, they get very stressed when they haven't swallowed for a long time. So we take a little bit of liquid, it could be juice, something fun if it's a child, and we can connect our hose here to the syringe. You can get, we have different size syringes. This is the one that I have in this one kit. And the other part comes with a connection that goes into your up-locker. So we can take the funnel out or the cap. Make sure you don't lose the cap, it's very small. And we are going to put the swallowing kit in here, and we can pull out as much as we need for that person to have the tube go into the dunder space. And then we put it in. So we can practice very efficiently, teaching people how to swallow properly, how to create, suction, close the compartment, hold it closed, and we have a lot of control with our syringe, so there's no stress and people can really learn. Kids can also learn to swallow, invisible swallow with it. This is an extremely useful part of our up-lock system, and you can get it on your Forwardontics website. In our kit, it's our deglution kit or swallowing kit, and it can be used with your up-locker activator. Our kit comes with a syringe handle. In case, for whatever reason, your saliva trap gets undone and you want to redo it for your patient, the rubber pack that's in there sometimes gets stuck. And this can be used to just put it in there and pull it out. And this way you can put in the connector back in, like that, and reconnect your saliva trap and put it back in your tube. So if this comes undone, you have a little handle that will help you pull it out and reposition it. So every time your patient comes into the practice, you can keep their saliva trap, just rinse it and put it back together for them, and they can come to your office every week or every couple days or every month, and they will have their own saliva trap, and you can put it in the tube and retest them. They can come in and practice. Kids need a lot of practice. They can come in. In our office, sometimes we have them come in, put it on, and we play a cartoon, 10-15 minutes cartoon, and they're holding and watching their pressure. Some parents also like to take a manometer in their home and make sure their kids are practicing meaningfully. Meaningful practice will give you the results to be able to hold your up-lock automatically without thinking about it when you go to sleep, for maximum nose breathing and restorative sleep.